So, what is the economic cost of the fourth trimester? Our guest, Dr. Sonal Patel, will answer that and more questions about her experiences, not only as a mom of four, but a neonatologist, and what she's done to take postpartum and the fourth trimester and increase access to care for moms who need that in all the realms from psychology, counseling, lactation, and pelvic floor physical therapy, which I totally love. Dive in. Let's start the show. All right. So I don't know about you, but anytime anybody's on YouTube or on the news talking about kind of pregnancy, postpartum, the fourth trimester, I've got a ton of friends that are throwing things in my inbox. And this one actually showed up before we connected, but on TEDx Ocala, which I think is Florida, um, this TEDx showed up with Sonal Patel, the economics of the fourth trimester. And I think in just a couple of weeks, you hit 24,000 views on it. And so we're so happy to have Dr. Sonal Patel on the show today to talk about the fourth trimester and all the costs and all the fun stuff. So thanks so much for being on the show.
Oh my goodness. Thank you so much for having me. This is amazing.
So you are a neonatologist by training, and then you also have four kids. Where does the mashup come? Like, did you have any sense that this would be kind of, the fourth trimester would be this impactful for you?
Honestly, no. I always say it was my professional where you can actually view women going through the postpartum. We had that unique lens being in the NICU. And then cemented or overlaid with that was just myself dealing with postpartum. And I jokingly say, but it's true, like I didn't have any issues pregnancy, but postpartum, you name it, I've had it. Even the types of deliveries. I've had an all natural delivery, no medications, barely made it to the hospital kind of scenario. And both of those things kind of collided in with each other and led me to discovering the actual term fourth trimester. I didn't even know it when I was having my own kids what it meant.
Yeah,
So
and your kids range from say tell me again the ages again.
yes. So I have a 17, a 13, an 11, and an 8. So a huge range from like almost going to college to elementary school.
But that's a lot of historical perspective, and you mentioned, I didn't know what the fourth trimester was. I don't know that that was even a word or a term until maybe more the last 6, 7 years. What did 17 years ago, just so we kinda have some history here, like, what did you expect going into postpartum? What was that supposed to look like, and then what did it actually look like for you?
You're supposed to, and this is what I mean. First of all, remember this was 2005, so we were just getting the iPhones, we were just getting social media, we were on that cusp of this new era that we live in right now. So at that time, there was just probably like mommy blogs that were out there that were very
Blogging
popular.
was big, yep.
Blogging was huge, and really, no, what I anticipated was I would just pop out a baby, feel better in like 6 weeks, go to back to work around 9 weeks, and everything would be roses. The Hallmark Hollywood, beautiful, everything. And it was a shocker. A couple of things that really stood out is first of all, I ended up having a C-section,
Mhm.
which is let's reterm that. Let's kind of next generations reterm that. That's abdominal surgery with the baby attached. They go through so many layers.
Major abdominal surgery, by the way. I had 2.
Yes.
Yep.
Yes. I totally love that you emphasize those major because you're absolutely right. And then you have this responsibility of not only taking care of yourself, but breastfeeding and providing nutrition to another human being. And breastfeeding was just being a pediatrician. Also, at that time, I was being trained in pediatrics. There was not that much education on lactation. And but just coupled with that physical recovery, I mean, it was like every time you sneezed, your scar hurt. Every time you like got up, or even like took
Mhm.
like go into the bathroom, like everything hurt and you were in constant pain. And I truly believe that, like, that physical pain that we underestimate with the fourth trimester really does lead to some of this mental anguish that we have as mothers and increases our postpartum depression rates, increases why we don't feel good, why things, and we, because we fail to recognize that we have so much physical pain. We're
Yes.
supposed to just kind of suppress it, and that's
I was
nonsense.
I was counting pills with my first, and it freaked me out. I was like, "Oh my gosh, I'm gonna run out, and then what do we do?" Um, I I I wanted to talk specifically about you mentioning, like, this is your 17-year-old because I feel like some of those things are different now, but some of them are the same. I still think moms come in thinking, "Oh, it's gonna be like the Hallmark Channel," and you spend it's kinda like the wedding, you spend more time on the wedding than you do on the marriage. It's like you do more, although I don't know what we're gonna do now without, like, Bye Bye Baby and Toys R Us is gone, all that stuff.
Yeah.
Um, we spend more time planning for the registry and all of that and nothing on the postpartum. That I don't th I think it's just starting to change, but I don't think it's been that much. What's kind of been your experience now, a couple, you're 4 kids in, you've been spending more time in this postpartum space, like, has that evolved or are we still stuck?
I think we're still a little stuck. I mean, I love that I'm on this podcast because I actually discovered physical pelvic therapy after,
Yay!
no, but it was life changing. And I didn't realize how, like, with all my deliveries, I actually qualified for it. And I don't think so, even qualify for it. I think there's this basic understanding that, you have, and this, not to get more in the gritty of it, but your pelvis does change. And just like, since we can't see those muscles, we don't realize the
Yeah.
amount of musculature that's there. I mean, it's your that muscle is like you're holding your body up and walking,
Yes.
so there's a lot of muscles that are involved, and they're very,
Yes.
but you don't see it. Like if you got a bicep strain, right, you knew it's something that you can visualize outside,
Mhm.
and something that impedes your day to day. And then you'll go to your provider, that they'll give you a physical therapy regimen, and you'll follow it and you feel better. And that is one thing that I underestimated, was my pelvic health, because now I actually am dealing with IC, which is interstitial cystitis.
Mm.
And I really think, if I had the appropriate pelvic care after each
Yeah.
delivery, I don't think I would be dealing with this. And so even after 8 years ago, that wasn't even very prominent still. And
No, it wasn't. And I
and then
think that's
until,
the I was gonna say, I think that's an important distinction to make. I mean, my youngest is 9. So much has happened in accessibility, in sharing of knowledge. I do think some of it's thanks to COVID and everybody's on social media and that sort of thing. But I wanted to ask you, in your medical training, understanding, you did
Mhm.
your basic medical training and then went into your specialty. How much education do you get as far as, hey, this is what's going on? Because I know in PT school, maybe we got a lecture and I don't even remember that. What did you guys get unless you go into
No.
OBGYN?
Yeah, you don't get that. But even like,
No.
but even my OBGYN didn't tell me, right? That didn't tell
Right.
me that it was, because I'm coming from the pediatrics lens, and I'm depending
Right.
upon my OBGYN providers to be like, hey, help me out here. But
Right.
until I had symptoms, right?
Yes.
And that's the fault of our healthcare system overall. It's that we don't focus on prevention. It's set up for not
Right.
focusing on that. It's set up for focusing on acute issues. So,
Right. And you said something earlier about qualify, and that's something that I'm hearing come up a lot. People that actually aren't in this space but are trying to be in this space, and they're like, "Oh, well," and usually it's people selling programs. They're like, "Oh, your insurance doesn't cover pelvic floor PT." Actually, not true. If you have physical therapy coverage in your insurance plan, pelvic floor physical therapy. We're just physical therapists. We just use muscle codes, that sort of thing. But there is actually a bill in front of the House of Representatives right now. It's to basically increase access to postpartum care for Medicaid. And you probably understand because you've been in medical
mm,
land for so long, as goes Medicaid and Medicare, as goes most insurances. And so there's efforts to try and get more of that. But again, like It's driven by payment. It's driven by, the knowledge that our providers have to refer us to this. But yeah, it's one of those things that if your provider doesn't know to refer you, then you think, okay, well, maybe I'm not bad enough to go. Or to your point, I don't want to have these issues. Let me go and see somebody so that I don't, or even if I do, I know kind of how to start to navigate it and so on. Um, in your kind of professional forum in like neonatology, you tend to deal more obviously with the kids. What would you kind of observe from afar as a mom, knowing kind of what they're going through? Um, the focus is primarily on the kids at that point. Where's the challenges for the moms and being seen for what's going on?
Yeah, and I failed to mention this before, but actually 5 years ago, I actually left the NICU to start my own home health company. And the challenges that we were seeing is moms barely able to walk. They're holding
Thank
their
you.
and and just sitting there, and you can see that they're in pain.
Yes.
Um, and the over the time, I mean, we have this ability to observe them for 2 months because usually NICU babies stay for a good chunk of time. You see them getting a little bit better, you see them starting to feel better, but underneath it you're just like wondering, hey, are you suffering more because I like literally the first week you barely could walk. And
Right.
and we do such a terrible job with even mortality, and that's the economics that I had discussed
Right.
in the TEDx. That we don't even do morbidity. I was luckily I found a really good pelvic physical therapist and my urogyne who told me that peeing and incontinence with peeing and pooping and all like I said, that's not normal, and
Yeah.
that's a culture too that we have to fight. It's like for people to understand that's not quality of
Right.
life, right? That's not us. So when I opened this company 5 years ago, initially the point was because I actually suffer from postpartum depression with one, postpartum anxiety for another, and my own medical system did not know how to help me. And my biggest thing was like, if they don't know how to help me and I know the system,
Right.
so it initially started with that, and then it's evolved to getting pelvic physical therapy education, at least the education. So all my clients will get the education,
Mhm.
and we do encourage them to find through their insurance, and just for them to realize that there's no qualification. The qualification
Right.
is birth. That's it. That's it. That's
Right.
all you. That's all you
Right.
need to
There's
know.
no other hoop you need to jump through. No, you brought up a couple of points, that I wanna go back to, um, that I think get forgotten. Um, that when you have a normal delivery, let's put it that way, or I hate saying a normal because 'cause they're all kind of all over the place. When you get to go home right away with your child, I think there's challenges. When you have a child in the NICU, when you have multiples, I feel like it's a whole other experience. I had a mom recently that I was working with. She had a toddler at home and delivered triplets. And I started working with her within 2 weeks postpartum because she had time because all the kids were in the NICU. And she's like, I have time to do this now. Let's do as much as we possibly can because I know the second the kids come home, it's going to be game on. And I don't know when I'm going to get back to myself. And so I don't think any situation struck me as much as that because literally it wouldn't matter how bad it was going on with her. She was always going to be putting those kids first. I feel like that's, a very extreme scenario. But um, if one aspect is just kind of understanding that part of parenting is like, in those situations, those moms get lost in the beginning. And then we have those moms that kind of get lost because of the overwhelm, like you said, of the depression and the anxiety and all those things that come with it that I swear to God probably never completely go away. There's always something new with kids. For you, like what have you kind of learned from your own experience and then how have you sort of implemented that into your home care business?
Yes. So what I've learned is even the research supports it, right? That the
Yeah.
foundation of a mother's mental health is directly linked with infant and childhood development. So the studies have been done that shows that if mothers' mental health is not addressed properly, the kids, their offsprings will have lower academic scores, will have decreased ability to have good social interactions, tools for that. And then on top of that, there's an increased likelihood for those particular kids to even have mental health issues of their own as adolescents and childhood. So when I started this home health company, people always were like, "Well, why do you worry so much about the mother?" And I was like, "Well, I'm selfish, right?" Like, well, it was a good question in the sense that you're a pediatrician and you're trying to
Right,
do a lot of maternal stuff. And then I was like, you know what? I'm selfish. I want my patients to thrive to their optimal level,
right.
and I know if I can take care of the mother, then
Yeah.
and make and empower her despite all the social media nonsense and Dr. Googling, but empower her to believe in herself,
Mhm.
then I'll won half the battle. So that's what I realized, that it was okay for my health to come, because with the IC, when I would get attacks, I mean, I would be debilitated. And then
Yeah.
you see that you can't really function. And I was scared because I was like, well, how am I going to raise four kids? Because I was
Mhm.
diagnosed about 6 months after my last baby was born. And so it was just like, well, I still have, at that point, I mean, it was 10 and under, I had kids. And it was just like
That's
this.
a lot.
It is. And I
Yeah.
could not imagine, like, how am I going to do this?
Mhm.
Right. And so that's why it's this. So in our home health companies, how's that's translated, we bring all medical care home. So we bring everything home.
Yeah.
As the pediatrician, I can do everything with the newborn. I'm also lactation, so I do the breastfeeding. And then for the maternal end of it, we screen for the questions, we screen for the vitals, we're get going, and we talk about birth stories in the first visit. We have these conversations because the simple act of me coming to their house validates for them that
Mhm.
they've gone through something big. Like,
Yes.
let's not downplay birth. Like, this is, I when someone told me, this woman was so angry because when I gave her all the stats and stuff, and she goes, "Birth never killed a man," and it was true, right?
Good point.
Good
Good
point,
point.
right? So it was that simple validation of, let's talk about your birth story. There's a lot of
Yeah.
birth trauma that's occurring, a lot of stuff that we are holding up. And then through the course, so our program is about 2 months, and then they go to their own medical home. We do coordinate with their OBGYN provider if there's anything that is concerning. Uh, and then they go to their medical home. But for those 2 months, it's basically also walking and coaching them through
Mhm.
this new landscape that we're in,
Yeah.
where people are telling them that they're not enough, and people, meaning people on social media, sometimes even their own, like grandmas always, that haven't like breastfed before, right? Because
Yep.
there's a whole culture that hasn't. um Apps, I do not like apps.
All right, unpack that. Why do we hate the apps?
I don't like breastfeeding apps because it's another way of taking away the time that they really do need to focus on the act of breastfeeding and kind of
Mhm.
looking at what the baby and them are doing
Mhm.
together. And then the information that you're putting on there, I don't care if you breastfed for 20 minutes or 40 minutes. My end point I'm looking for as a pediatrician, as a professional, is how many poops they're having, and if the poop is changing color, and how many diapers are having, because that does my intake. Because some, it's just like every human, right? Each human is different. Some babies come out breastfeeding and they are done in 20 minutes. They're like, don't do me again. And some babies need a little bit more coaxing.
Yep.
And really, we focus more on the baby's act, but you forget, again, here we're going back, you forget the mothers, right? So, for
Yes.
example, if a mom had a C-section, well, that might not be a very comfortable position, fill in the blank, to breastfeed, correct? Maybe they've had a grade 3 and a grade 4. They need a donut because it's really hard to sit up and breastfeed on
Mhm.
their pelvis. Maybe they've had issues with sciatic nerve issues. Maybe they've had issues with shoulders. I mean, there's so much happens in pregnancy that
Absolutely.
carpal tunnel, maybe they can't hold their baby correctly. So again, we focus on more on the baby rather than the mom, and it's a dyad, it's mom and baby. So you have to, with breastfeeding, you have to look at both. You can't
Yep.
just focus on baby. And sometimes, there's everything gets focused on baby, but then there's this mom who, she's dealing with lumps and she's like dealing with all of this and she's not voicing that. So that's why I don't like the app. So all I need to know, for me personally, how many poops and pees. And so most of my clients, what they do is, they, wherever they're changing the diaper,
They get
they
to
just put a
start.
notepad.
Yep.
They just put a notepad, like,
Yep.
click it off. And then you're not on your phone.
Yeah.
Again, going onto an app and putting in data information, while it might say, some people may be like, well, it only takes 5, 6 minutes. Yeah, but that's 5, 6 minutes for you to eat or pee or
Yeah.
focus on your baby, hold your baby, stop feeling that you're just like a
It
milk,
definitely
like a
changes it.
cow,
Yeah. Yeah.
right?
I think it also too, and in the beginning, you wanna do everything right, and
Mm,
to your point, like, I've had so many clients that, they're tracking all this stuff to a fault, that it almost turns this into a job.
mhm,
And don't get me wrong, there's a lot of repetition, especially those first 6 weeks, and you're kind of learning this stuff, and it sometimes can feel that way, but when you're literally quantifying, it changes the whole kind of vibe of that. You mentioned something earlier I wanted to go back to about, I think this is especially with first-time moms, um, that comparison trap. You're surrounded by a lot of family now, you have these stories that have been passed down about what you were like as a baby and what your mom was like. I mean, my mom, I think she was building our house or something when my sister was born, and the story is she made my dad's dinner while she was in labor for me and then went to the hospital or something along those lines. For you, what stories, what expectations kind of were passed down to you culturally that you had to navigate as a new mom, and how does that come forward now in your work?
So I will actually tell you one of them, in a sense that it is so positive, but the Western culture made it sound so negative at the time. And now I'm like, I leaned into it more and more as my pregnancy went around. So in our culture, we're supposed to be in bed for 11 days.
Mhm.
The Western culture has this thing that you just need to bounce back and go back to work, right?
Mm.
So those two things were, with the first pregnancies, were first postpartum was super challenging because I actually was a resident. I had 9 weeks off. I'm coming from this world of working 80 hours a week, coming from this go 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 type of attitude. And my mom and my mother-in-law and all for my deliveries, there was this understanding that they are just going to come. And they did. My mom's actually an OBGYN physician as
Ah!
well. Yeah. So but she would not take any patients that were around my due date. So she could be there for me 2 weeks afterwards. And then my mother-in-law 2 weeks after that. And I I remember my own fault was I wanted to do everything. I wanted to conquer everything. I wanted to
Mm.
show my mom and my mother-in-law that I did not need their help, while they were telling me to take it easy, tell me what to do, how to do it. We're here to help you. Let us do this part of it. And that really was both the Eastern and Western kind of coming together and colliding. Um, and then you find so much. Now in retrospect, I was like, well, why did I just sit there? Right?
That's also a little, that probably takes a little getting used to, I don't know, I mean
Yeah, like why didn't I think it was okay for me not
Yeah,
to do that when they're telling me to do it?
right.
So I think that was an interesting kind
That's
of
a
dilemma to navigate.
that's a good question. How did that evolve from your oldest to your youngest? Did you eventually sort of just give in, or did your family just say, "Okay, 4 kids, we're not coming anymore?" Like, what happened?
No, that's the cool thing. It was always the understanding that they came. I think if I had
Ah,
8 kids, they would have
they would
come.
still come. Oh, that's a great
They
family.
they would still come, but that's my culture. That's the Indian
Mhm.
culture. that's that part of it, right?
Mhm.
And also, if you dive down more into the Eastern kind of cultures, there's particular foods you eat for the heats and the and at times you're just like with your first, right, like a first time mom, you're just like, well, that's just wrong. But it evolves to, okay, well, I had digestive issues in my first one.
Right.
Breastfeeding didn't go so well. Maybe I should
Right.
listen, right?
Yeah.
Maybe I should take this in. Maybe there is this component of it. I mean, remember, birthing was a women's community um, celebration.
Yes.
The women of the community would come around and take care of this mom and take care, and they provided, and there's a lot of historical and cultural and educational information about food that's been passed down that
Yeah.
we ignore. And
Yep.
so like for my culture, there's particular lentils that you eat
Mhm.
in particular weeks because it helps with the digestion, and makes sense, right? If everybody remembers their first poop, it's like the
Yes.
most painful. And you're like,
Somebody
why?
was
I just
onto it with
delivered
the
a baby.
lentils.
There you go.
That's awesome. That's
So
awesome.
over the last four, I mean, I think the circumstances on my fourth was a little different because I had preeclampsia. So he came
Mm.
earlier than my mom could come, but my mother-in-law was here too, and she was trying to help. And so there was a little bit of a couple of days, 4 or 5 days, where I did not get like that immediate help.
Mhm.
But when it came, I was like, yeah, I'm
Take
just gonna
it.
sit. I'm gonna
Yep.
take it. I'm gonna sit. I had my nanny at that time. I was very fortunate for that too. But overall, regardless if you have the ability or not, is there's this underlining understanding in the culture that birth is important and
Mhm.
maternal health is important. Um,
I think that's such
yeah.
a good point that's come up with a lot of people that I've spoken with on the podcast is historically there was this community. It was a community birth. There would be community support in pregnancy and postpartum, and that community has changed. And we'll see it in meal trains and things like that, but it's not that immediate support. And some of it I think has shifted virtually that, people are scrolling at 2 a.m. looking for resources. But I think also, individuals like yourself, where you're coming to them. There was a huge surge in my profession in pelvic floor therapists going into home care. And I think it's fantastic for a bunch of reasons. Typically the people doing it, the physical therapists doing it are moms themselves, so they're looking for flexibility in their schedules, but they also understand how hard it is to get out of the house to get an appointment. Like, I remember our first pediatrician appointment, and I was so, and you remember this with the C-section, so swollen. Like, I had to send my mother-in-law to Target to get bigger underwear because I couldn't get my leg through the hole. I don't think I could fit into shoes. I had to wear slippers to my first pediatrician appointment. I'm sure we were late because God only knows what was in the bag. And I just don't remember that being a supportive experience and being afraid he was going to cry. Of course, he's going to cry. That's what they do. But I would have loved to have somebody come. I did have a friend who I had de Quervain's tendonitis, so the mommy thumb, really, really severely, so that when I changed my son and he kicked my wrist, like right here, which he often did,
Mhm.
it just sent me through the roof. And so, if a dear friend of mine who was a physio came to my house and treated me there, but that was as close as I got. But I think having the option for home services, it takes down that barrier of, okay, I need help, but I also need that community to come to me and support me. So I think that's really cool that you're finding a place and a space for that because again, that community, that village has shifted. It's not ready made like it once was. Um, so for you, kind of looking ahead, since we're noticing changes, things are definitely better than they were, 17 years ago in some aspects. What can we do now? Um, to change, to make an impact for moms, to make an impact for those of us with daughters, or sons who are gonna have kids, like, what can we do? What kind of, foundation can we lay for them so things are gonna continue to evolve and give them more support in the 4th trimester?
Yeah. So a couple things. So individually, please, like you mentioned before, it's investing in the marriage, not the wedding. Please forego the $800 strollers. You're gonna baby carry, even if you don't want to. You're gonna baby
And it was like
carry
5
the
strollers
first,
anyway.
the first like 6 months, and then just invest in an umbrella stroller
Mhm.
because they're developmentally okay to set up with some support. So really looking at what you're getting, um, for basically signing up for your registry services that will help diminish your load in the postpartum. It could be as simple as like meal services to, okay, we're going to invest in like a cleaning lady or postpartum doula services. Um, invest in your health.
Mm,
Take that money and invest in your health. And really to have, I see this a lot with the men once they realize, because it's services are not materialistic, and
mhm.
so there's not a tangible thing. However, the services actually are far better than the tangibles, you know.
Yes.
And so I,
100%.
I always I always say on the registry, if you found a doula service or whatever, pelvic therapy, whatever services, put that on your registry. Get people to
Yes.
pool their money in for, instead of that like 10th billion cute outfit that this child's never going to wear, spend that $25 or $30 and put it in a pool so this
Yeah.
mom can get whatever X, Y, and Z service. Maybe a dog service. Maybe you don't want to walk your dog all the time. So that's one. Number two, women are very reluctant, especially when we turn moms. We're really reluctant to ask for help. And one way, then people are coming over to help, right? But we're in this dilemma of how to help. I always encourage them to make a list of to do, like what
Mm,
happens, like as simple as, the trash gets put out on Thursdays,
yep.
or please, if you're here to help, please just walk the dog, or we are needing of, please wash any of the dishes, or if you could do the laundry. And it's
It's just
okay.
understood. Come in, look
Yeah.
at the list, don't ask me for anything. I
Yeah.
love that. That's
Yeah,
great.
yeah. Because here's the deal. When you're done with your postpartum, like obviously you're never done, but when you are feeling better, you can always thank them.
Yes.
You can thank them. So, and then you can thank them by paying it forward when that
Mhm.
mom is in that scenario. So that's the other. So those two things, to really invest in services that will help diminish the burden load and the workload, and
Mhm.
then also putting it on registry, for those services. Number two was making just a list of where what people will know. And the third thing is, please do realize, and that's why I opened my NayaCare, is that the medical community, I feel, biggest critic of my own community, we need to step up
Yeah.
and do more of this. So not only, my NayaCare is in Denver, Colorado, and we serve the metro area, but there's actually about 15 to 20 physicians that are doing this all around the country. And
Mm.
I'm the co-founder and co-director of a national nonprofit that we opened 2 years ago. It's called Center for Fourth Trimester Care, and really holding the medical community accountable for
Mhm.
what is actually going on with maternal health, with maternal mortality and morbidity, and realizing that we actually need to step up and become part of the community in a more,
Yes.
direct and meaningful way. So
Yeah.
please check us out. Anyone can be a member. Anyone who wants to be in this space and change it. The reason we opened it is that when we looked at the landscape, you have ACOG, which is American College
Right.
of OBGYN, AP, family practice, psychiatry. They're all looking at this postpartum period from their own lens, but
Yes.
there's really not enough communication between the
Yep.
groups. And so we wanted to bring everyone under the
That's
same umbrella.
fantastic.
Yeah, so
Yeah.
our board is like OBGYN family practice. We actually even have a PMR, on our board,
Great.
because just really to understand that
Mhm.
this is a new field that has so much economic power because women at the end of the day do have the economic power, and we just need to step into it. So please check us out. Again, anyone can be members if you're really interested in helping change the national narrative
That's
of
fantastic.
postpartum.
No,
Yeah.
I was president of the Academy of Pelvic Health Physical Therapy, and I remember in 18 when, ACOG came out with their 4th trimester, statement, and we were just tiny, tiny, tiny little mention, and it was just barely what we do. It just barely scratched the surface, and we wrote a letter, it was published in the Green Journal, and we're like, "Hey, thanks. Thanks for, we've been doing this for a while." We're kinda like the social workers, I'll be honest. I was cracking up when you were like, "Oh, all these people, all these disciplines." We're the ones that end up organizing it. I swear to God. Like,
Hmm.
that's half of what I do like is that, with that early access and talking about, we need to be, touching base with moms earlier, that just supported what a lot of us are doing in the community anyway, getting access within the first couple of weeks. But again, I think you highlighted a really good point about connecting that community. When I see a mom at 2 weeks postpartum, either virtually or in person, I'm checking the boxes like, okay, how are you feeling? How are things going? Like that's my first question. How are you? Not how's the baby, because that's the first question sometimes when you go to do your 6-week visit. How's breastfeeding going? If you're doing it, do you have a lactation consultant? How's sleep going? Do you have a doula? Like, how do you bring these things in? And lots of times they don't know what they need, and they don't know that these people exist.
Yep.
And I think having that clear communication of here's all of us that are in the sandbox, how do we connect together? And I think that's something that we've been inherently doing in our profession for a long time because that's kind of what we do in other aspects as well. Like as a pelvic PT across the board, I deal with urogyne, colorectal, neurology, orthopedics, PM&R, all that stuff. Like that's just kind of organic to who we are. But I love that that's getting put on the physician level because again, I think that's very culturally in medicine, everybody's in their boxes, and it makes it really hard as a patient to get everybody to play in the same sandbox together. So I'm so glad to hear
Yeah.
you that you're doing that. That's awesome.
Yeah.
Now you
Yeah.
have some resources. I'm going to pop up here your Instagram, but tell me a little bit. You said you book and you've got a couple other things going on.
Yeah, so so that's I wrote a book called The Doctor and Her Black Bag, and it's reflective of basically how old-fashioned care can
Mm,
change and alter maternal mortality, which is my biggest platform, and for people to understand how dangerous birthing is in the United States, but people just don't understand because there's always a blip on the news. I mean, just in 2023 of March, and the newest data came out, and it was shocking. Our data is it's a rate. So really briefly, it's a rate. We are 32. The closest is Canada, which is 8. So
mm,
you can see that. So the book, it's divided into 4 parts. The first part is my story of how I got into this work and my professional and personal. The second part is I love medical history. So I really want to know what happened with postpartum, like
mm.
what cultivated where we are right now. And the third part is the research behind changing like all the components that need to be changed. Um, just from basically home visits, the paid family leave, how that affects breastfeeding, and then how that affects mental health and how that leads to the economic benefit. And then the last part is like moving forward, like what can we do moving forward, like the question you asked me. Everything is available for free on NayaCare.org/book. So everything on there, you can get the Audible free, you can get the book free, the digital version of it, and then it's also on Amazon. And then, yeah, join me on NayaCare. We do a lot of, we collaborate with a lot of other people that are doing such amazing work in this particular field. I really want to emphasize pelvic physical therapy because it is life changing, like life
I love it when people say
changing.
that on like
It
I didn't
is.
have to provoke you to say that.
No, it is. And it's like, And investing in your health,
Yeah.
even from a male's perspective, you want your
Yes.
wife back, you want your partner back, invest in her health.
Yes.
You
Yes.
know?
No,
So
that's
please,
fantastic.
please do that. But
That's
yes, so
fantastic. And if anybody wants to, I'm going to put the name of the TEDx too. If you want to check Sonal out on the TEDx, it's if you can just Google the economics of the fourth trimester. It's really interesting. She kind of breaks it down to be like, hey, what's the cost of this? And I think it, especially, I think it's eye opening if you're about to go into pregnancy and postpartum and you really have no sense about how this is all going to play out, but if you are on the other side of that, you're just sitting there nodding and you're like, "Yep, mhm, 100%. I totally agree with that." So, thanks for posting that up there. All right, if you want to know a little bit more about NayaCare and the services that Dr. Patel provides, you can find her on Instagram at NayaCare. Thank you so much for sharing your story and being vulnerable about what you've kind of gone through yourself, and kind of paying that forward to moms that you work with now, and then also contributing to advocacy. We really appreciate the efforts, and I do think that things are much better. We got a lot of work to do, and it's good to know there's voices like yours that are kind of pushing things in the right direction. So thank you so much. And thanks for being on the show.
thank you for having me. This is amazing and awesome.
Thanks.